I think I'll need co-host to be able to share my screen. All right, can everyone see that all right? All right, so hi everyone. Today I'll be presenting on my project, which is a Tableau dashboard visualization that encompasses market research on the state of health in the United States. So here for my first worksheet, we can see the healthiest cities in the United States. And this data is from 2022. We can see that the least healthy cities are visualized by these yellow circles, and then the green ones are the healthiest cities. So the tooltip is what pops up when you hover over these marks, and you can see the city, the state, their ranking, and also the health scores that these cities are measured on below. Next, we have a bar chart of the unhealthiest cities, and we can see that these cities such as Brownsville in Texas, Gulfport in Mississippi are among some of the least healthy cities based on these indicators. And this bar chart goes down until we can see the healthiest cities. Next, we have a study on the healthiest counties in the United States. And these are the top 500 counties ranked on 10 indicators of community health. And this study was done by the US News Report in collaboration with CVS Health. And we can zoom in on the map and again hover over the different counties to see their rankings and also the scores they received on their health aspects such as food and nutrition, population health, public safety, and more. And on the side, we can see these filters that have the country health rank. And you can also slide these sliding bars in case you want to see, say, the top 250 healthiest counties. And next we have a bar chart. And this again shows the unhealthiest counties. At the top, we have some counties in Nebraska and Wisconsin. And going down, again, we have the healthiest counties. This next worksheet is on the median age by state. We can see the youngest median age is in Utah, where it's about 31.1. And there are a lot of darker red colors that indicate a higher median age. Here around Maine, it's 44.8 years old, and also relatively higher in the upper Northeast and in Florida as well. Here we have a bar chart that more easily visualizes which states have the highest median age. We have Maine, New Hampshire, Vermont, and West Virginia. The youngest states, Utah, DC, Alaska, and Texas. The next map is on life expectancy by state. We can see California has a really high life expectancy at 80.9 years old. And we can see that also Alabama and Mississippi, West Virginia, they have the lowest life expectancies in the United States at around 74.4 years old, which is around 5 years lower than the highest state. Here again, we have a bar chart showing the life expectancy by state, the lowest life expectancies, and then down here, the highest life expectancies, where Hawaii is the highest. Next, we have a map on the percent of population with multiple chronic conditions. And this is defined by patients living with 3 or more of the following chronic conditions. They include conditions such as chronic kidney disease, chronic obstructive pulmonary disease, cardiovascular disease, and more. We can see over here, this area has a high percentage of patients with chronic disease. West Virginia is the highest with 18.8% of the population with more than 3 chronic diseases. Here's the bar chart that helps visualize that, the chronic conditions by state. And next we have some more specific data on different chronic conditions. So we have arthritis, which is pretty high in West Virginia again, with 38% of people. We have the bar chart for arthritis. We can see West Virginia, Alabama, and Kentucky are at the top. Next, we have asthma. Again, when you hover over the states, you can see the tooltip pop up, and that information has the state, the ranking, and the percentage of people diagnosed with that condition. Here's the bar chart for asthma by state. And next we have cancer, which is the percent of the population diagnosed with any form of cancer other than skin cancer. We can see this red state is South Dakota, with 8.4% of people diagnosed with cancer. It's also pretty high in this area with Maine and Pennsylvania. And here's the bar chart that visualizes which states have the highest rates of cancer, and also at the bottom, which states have the lowest rates of cancer. So it's pretty low in states like Texas and New Mexico. Next, we have a map that shows the percent of the population with cardiovascular disease. So this includes patients suffering from the following, such as heart attacks and strokes included. You can see it's very high in this area over here, 13.8% in West Virginia. And it's lower in the area next to California and also pretty low in the Northeast. Here's the bar chart showing cardiovascular disease by state. Now we have kidney disease, which is similarly red in areas such as around here in the middle and in the south. West Virginia, again, being the least healthy state in terms of chronic kidney disease. And here's the bar chart. And here's the percent of the population with chronic obstructive pulmonary disease. This is patients diagnosed with these lung diseases, such as chronic bronchitis. Again, it seems that the trend follows where the states over here, such as West Virginia, Kentucky, and Tennessee, are among the highest with patients diagnosed with these diseases. Here's the bar chart. And now moving on to diabetes. It's relatively high in areas such as Texas and in the south over here. And you can see the blue states show Washington, Oregon, Montana, California, especially Colorado, which is the healthiest state in terms of diabetes diagnoses. And here is the bar chart that visualizes diabetes by state. West Virginia has 15.7% of the population diagnosed with diabetes, as compared to Alaska, which only has 7.6%. So these are the maps that I have so far. Next, I'll be moving on to chronic health risk factors that include aspects such as high blood pressure, high cholesterol, obesity, and after that, I'll be moving on to other behavioral and physical health conditions, which will kind of allow us to determine which areas we want to focus our services, such as bariatrics or mental health services. And lastly, here's just a different format. I tried the story format in Tableau, where you can click through these maps. So this story is on geographical health and age statistics. You can click through these and see the information that we went over. The next story is on national chronic condition statistics. This includes all the conditions such as arthritis, asthma, cancer, heart disease, and so on. So this is what I've been working on in the past couple of weeks. And thank you for listening, and let me know if you have any questions.
Another fantastic presentation, Helen. Thank you. What is the next steps? How much do you have left in terms of chronic illnesses and mapping it all out?
So I finished with the chronic illnesses, and next I'll be moving on to the risk factors, which are those graphs you saw at the end. And then after that, I'll be importing the data I gathered on all the physician compensation, burnout, and etc.
Great. Are you open to some ideas for the next projects in Tableau? And when do you think you want to move forward with kind of another Tableau project?
Yeah, definitely. I still have a lot of data in Excel that I want to import and create visualization for. For example, the physician specialties and all that physician data, but I'm happy to hear any other ideas that I can add to this project.
I could recommend a risk assessment for insurance, seeing where per population insurance companies are spending the most amount of dollars. So let's say, if Texas was to be getting paid the most by payers, we're going to probably say that's the most expensive state for an insurance company, top rated. We're talking just health insurance. So that could probably be an interesting overview, right? Where are insurance companies spending the most amount of dollars?
Okay, I'll look into health insurance data as well.
Right. Only if you have the time. Yeah, no rush, just an idea. And are you able to share any of the Tableau work, or how do you save it and how do you share it?
I know there is a option at the top for sharing. I think you can share it as a link that can be accessed on Tableau online.
Okay. I know this one is your personal account, right? One that is involved with not involved, attached to your academic email address.
Correct.
So if you could send me an email, and that way we can get access to everyone. We'll do a company Tableau. So either they can view it, and full disclosure, if you do have an academic email, Tableau is part of a 1-year, I think, agreement with every academic institution out there. But that does not include private equity. So we'll go ahead and if you can share it with me, we'll go ahead and establish an account with them so everyone can view it who doesn't have a Tableau account. Although this recording will be made public. Okay. Public meaning to you guys, not everyone. Thank you, Helen. Let's open it up for Q&A. Any feedback, questions, guys?
I was actually wondering if you have any idea why West Virginia might be so unhealthy. What might contribute to the diet or lifestyle or overall structure of one state?
Yeah, I noticed that as well. I can take a look at the health indicators that they measured in the healthiest cities and healthiest counties, but it seems like a lot of the indicators are based on fitness, food, and green space and healthcare. So perhaps just West Virginia is more lacking in those areas, and that is why some of the chronic illnesses are more common in those areas.
Kind of on that, I was curious to see if there would be any correlation between the population size and then the healthiness, because I know that West Virginia has a lot of outflow of population. I know they've continuously been losing, so I'm curious if that impacts their economy and that in turn impacts the health side.
Yeah, that would also be interesting to take a look at.
Any other questions? Okay. Looks like you enjoyed the project, Helen, and continue to enjoy it, which is great, right? Because we get a ton of information from Tableau. I think all of us can agree that we learn visually a lot better than we do reading something or listening to something. In this context, I think we're doing all three, right? We're reading through the slides, we're viewing the bar graphs and the line graphs, and also obviously listening to the presentation that you've just made. So thank you. Let's close it off. And tomorrow morning, I think, do we have a roundtable tomorrow morning? I think that was the agreed upon plan, right?
Yeah.
Yes. So we'll do roundtable tomorrow morning, 12 o'clock. Do we have a case study for, Sagit, do we have a case study for financial review? Or we already did Dr. Coquette?
Yeah, we
And that
already
was-
did Dr. Coquette. Waiting for 2 NDAs and financial stuff. So I don't have anything yet, but I'll let you know.
Okay, sounds good. So we're now with a 9 a.m. and a 4 p.m. roundtable. Friday, we're going to be doing our training with Donald. So we'll confirm that and send everyone an invite once again. Thank you all for your flexibility. I know I'm on the road, so we have to push it up by 1 hour. I'm on my way to a meeting in New Jersey now, but I will still be readily available on Podio if you have any questions or need my help. Okay? Take care, everyone. Have a great rest of the day.